Hi, I'm Robin O'Meara, the program director, and I wanted to just record a brief PowerPoint presentation I usually give on your interview morning that kind of goes over the curriculum in a nutshell. And I did record my face on this video just so you didn't feel like you were sitting at home alone watching nothing fun. Hi, I'm Robin O'Meara, the Briefly, all programs have a mission statement. So when we designed this program about 5 years ago, because it was a new program, we got to come up with an entirely new mission statement. So we really wanted to focus on providing a residency that really focused on teaching. So continuous search for knowledge is in there, but also on serving the communities that we are from. As well as physician wellness. So that kind of goes with our mission statement, as you can see, and then our program aims are really to foster the health of the communities that we serve, to provide high quality care for our underserved patients here in West Michigan, and then to balance that in a positive, supportive learning environment. So you're smart and I can prove it. You've made at least 4 great decisions to get where you want to be. So to go over those, first one is picking family medicine. These t-shirts were both bought from a recent AAFP meeting. I own the Will Give Advice for Tacos t-shirt. That's mine, and I wear it quite often during our virtual didactics. Decision 1, picking family medicine. Like I said, I think family doctors, we make huge impacts in the communities we live in. An increase of 1 primary care doctor per 10,000 people has been shown to result in decreased outpatient visits, decreased ER visits, decreased admissions, and decreases in surgeries. And I think that's because having a family doc in your community helps the patients we see, but it also helps their family members, the people that they take care of. So us just giving people healthy advice kind of trickles down into the community. Decision 2 is looking at a residency in Michigan. Being an Illinois native from Chicago originally, I very much appreciate the beauty that's in the state of Michigan, and I'm super glad we moved here. I love living in a place with 4 seasons, so if you're from a warmer climate and maybe this isn't your thing, I would challenge you to experience it. The summers are absolutely beautiful on the west side of the state. You can see that picture. The Pure Michigan summer is from one of the local beaches. We have a lot of sand dunes, and Condé Nast named this side of the state one of the 10 places you should see before you die. We all know there are dreadful winters sometimes in Michigan, and it can be quite cold. So just remember there is that 5th season, and make sure you have a warm jacket. Grand Rapids, why you should like Grand Rapids. Grand Rapids is a kind of an up-and-coming area, very popular with millennials. It's also called Beer City. There's tons of places that a foodie would love, tons of restaurants. We do have DeVos Performance Hall, Frederick Meyer Gardens. Those things bring in, big names, music shows. I just saw Hamilton this year. We do have minor league sports teams that you can go see as well. And we love the Griffins. My kids and I usually go there a couple times a year. So who are we as a program? We're a medium-sized university-affiliated program. We're affiliated with MSU, obviously. We take 6 interns per year for a total of 18 residents. Spectrum Health itself has over 300 residents and fellows in 21 specialties. Ourselves, the family medicine program, we're very friendly, we're very teamwork oriented, and very family friendly. We're just a pretty happy group all around. Who are we as faculty? I'm not going to go through each name, but I'll just kind of point out some highlights with areas of interest. Dr. Holman is an MSU clerkship director, and so obviously has an interest in med student teaching. Dr. Snyder is the associate program director and has interest in gynecology and women's health as well as pediatrics. Dr. Wallace is a DO who does osteopathic manipulation as well as runs the OB part of our program and does deliveries. Dr. Armstrong is a DO who has a works with the Spectrum out in Sparta. Dr. Davidson practices inpatient medicine and outpatient medicine, so you will often work with him on inpatient service. Dr. Wilder is our newest addition. He's a DO with some interest in sports medicine. as well as vasectomies. Dr. Van Acker is an osteopathic physician who does osteopathic manipulation. And then Dr. Lambert is she's a licensed clinical social worker, and she is our behavioral health faculty on staff who runs wellness groups and resident support groups. Anne, who you've probably all met or talked to a little bit through email or on the phone, is our program coordinator. And behind every good resident is a great coordinator. I totally agree with that. During your interview time, I always caution residents, pay attention to how the coordinator is treating you, how they correspond, make sure they're getting back to you appropriately, because that can really impact your residency experience. This is our intern year class. Hopefully you'll get to meet some of them. It's hard to meet resident or interns during interview season, but we're going to try to have some social hours where you can meet. So what do you do in your intern year? In our program, we have two campuses. We have kind of what we call the downtown campus and then the United or Greenville campus. Downtown would include Butterworth Hospital, as well as Helen DeVos Pediatrics Children's Hospital. So downtown, during your intern year, you're going to do 2 blocks of pediatrics, 1 block of internal medicine on the floor with the IM team, 1 block of medical intensive care unit, and 1 block on the OB floor, primarily with the OB residency and the nurse midwife team, so lots of just normal vaginal deliveries and procedures. Up at United, you'll do 2 blocks of family medicine service. That's our inpatient adult medicine service. 1 block of surgery, where it's a great block where you get to work one-on-one with one of our rural surgeons, and 1 block of newborn nursery combined with OB. And then outpatient, you'll have an orientation month. You have a block of sports medicine, 1 block of research and radiology, and 1 block of population health. So every year at our program, you will do an orientation month. During your intern year, you spend most of that time being oriented to our program. So we'll teach you about our EMR, which is Epic, both inpatient and outpatient, how to write notes quickly, how to order things. We will ramp up your outpatient patient care so that you're used to seeing patients in your clinic. We will teach you lots of different procedures, get you certified in Nexplanon, teach you about IUDs, central line insertion, intubation. All of those things kind of happen during that month. And then in your second and third year, we do some additional procedure training. We spend some time getting people certified in Suboxone so that they can work with our MAT treatment clinic. And we also have you as a second and third year function as a senior, so working with the interns in their clinics, trying to help them with their schedules and on the inpatient floors. During orientation month, I should also say we do a lot of group bonding. So we will have you go on some kind of assigned fun activities with your classmates as well as with people who work in your clinic. Okay, so the differences between United and Butterworth Hospital. United Hospital is a small rural hospital. It has 42 beds, average daily census of 23, 470 deliveries per year. So when you're on OB, you'll both be rounding on pregnant women, triaging them, doing the deliveries, and seeing the newborns after delivery. They do lots of inpatient surgery there, as well as many orthopedic outpatient procedures. It also has a 39 long-term care facility attached to it, like a nursing home, where you guys will do some nursing home rounding as well. And that nursing home experience continues through all 3 years of your residency. You'll also do your emergency medicine up at United. Last year, they had a total of 32,000 visits, 4,500 which were pediatric. So a good number of pediatric visits in the ER. Butterworth Hospital, by contrast, is very large, 634 beds, average daily census of 464, greater than 100,000 ER visits each year, has all the other residencies you could probably think of. The nice thing is you get access to all those elective specialty areas that you may want to be doing in your second and third year. Helen DeVos Children's Hospital, 234 beds. You can see the average daily census. It has a PICU, a NICU, a dedicated PEDS ER room, which sees over 50,000 visits per year, and 40 pediatric specialties. Again, those specialty rotations would be available to you for your elective. Okay, so what are you doing in second year in our curriculum? You will spend a total of 5 months doing inpatient work, 2 more blocks on our family medicine service up at United, 1 block of that newborn nursery OB rotation, and then 2 blocks in the ER. You have lots more outpatient in your second year. You'll be doing the orientation month we discussed. You do an office-based pediatrics month, a block of gynecology, a 2-block surgical specialty longitudinal, which kind of rotates you through different surgical specialties. And in addition to, while you're on that month, you're also doing your clinic. And then you have 3 blocks of electives. In your third year, you have not so much inpatient, mostly outpatient, which is great, kind of progressing to an outpatient clinic. You have 1 block of FMS in your third year and 1 block of ER. Outpatient, you're going to be doing medical specialty longitudinal, which again, similar to the surgical one, is 8 weeks long. You'll rotate through different medical specialties to kind of just get a flavor for who they are, why you would want to consult them, what kind of things you should do before consulting them, as well as doing your outpatient clinic. The behavioral health longitudinal is interesting because you get to do a little of inpatient psychiatry, a little inpatient addiction medicine, some outpatient addiction medicine, as well as some pediatric behavioral health while you're doing your clinic. You also get a block dedicated to geriatrics, the orientation month we discussed, a block of orthopedics/sports medicine in your third year, and then 1 whole block, which is basically a clinic month. We're calling the Family Medicine Health Center month. In addition, you'll be doing some med student teaching during that time, and then 3 blocks of electives in your third year. What's the difference between the 2 clinics? So we do have 2 outpatient clinics each year in our class of 6, the 6 interns coming in. 3 will be assigned to the downtown clinic and 3 will be assigned to the rural clinic. So downtown at 25 Michigan, right across from the main hospital, we have a very urban clinic. Both clinics are actually located right next to the hospital. They both mostly see Medicaid or Medicare patients. The total number of visits between the 2 clinics is essentially the same. The difference really, the downtown clinic sees a lot more younger women, which makes up 20% of the total visits, and less geriatrics. There's also an OB clinic at downtown, which I kind of mentioned. Dr. Wallace does our OB, and so that just brings in more women of childbearing age. The Greenville clinic definitely has more geriatrics, so if that's something you're interested in, definitely a higher percentage there. And both clinics tend to see more women, as do all outpatient clinics. Women tend to go to the doctor more often than men. Here's the most common diagnosis you're going to see at the 2 clinics. As you can see, pretty standard family medicine stuff. So if this does not look like stuff you're interested in seeing, you're probably in the wrong specialty. But for most of us, this is bread and butter and things we're happy to see on a regular basis. This is just pictures of clinics, or pictures of residents from the 2 clinics here. Didactics are every Wednesday afternoon from 1 to 5 p.m. We rotate your core topics. We also go over ethics. We have a safety event report that each resident will do. Residents give a senior talk. We do board review and journal club, as well as dedicated research time during our didactics. We also have advisor sessions, personal time, and support meetings during that time. So we really try to maximize your time at the didactics so we can kind of fit everything in. We also do practice management, which is exactly like it sounds. It helps you learn how to manage a practice when you graduate. So we do go over finances, different types of insurance, billing and coding, job hunts, CV building. So all of that is kind of built in. Some unique aspects of our program are our culinary medicine curriculum. So this is a curriculum that came out of Tulane, which teaches physicians how to cook healthy meals and teaches us about nutrition so that we can pass this information on to our patients. This is a picture of another kitchen we often cook in and at the downtown market in Grand Rapids, which is just lovely. It's a great space. We also had a grant to apply this to our patients, and so any patient who qualified, who had a child in the obese range, could qualify for family kitchen teaching so that they could learn to cook healthy meals for themselves, and these are just some of our clinic patients. We also have the lifestyle medicine residency curriculum. We're one of 13 family medicine residencies in the country with this curriculum. It is integrated into your residency program, into our didactics, and we give the 40 hours of in-person didactic material during your time here. And then if you want to go for certification, you have to complete an additional 60 hours of asynchronous application. We can do most of that through a lifestyle medicine residency elective. And then you would graduate with additional qualification to sit for the American Board of Lifestyle Medicine. So you could get boarded both in family medicine and lifestyle medicine upon graduation. We have a really amazing sim lab through Spectrum. So it's an entire building. We have electronic models for both CPR and OB that deliver babies. They blink their eyes, they turn their heads. The OB model can dilate her cervix and have a postpartum hemorrhage. The model during coding can tell you if your chest compressions are adequate. And so we also do casting clinics. We do ultrasound workshops 4 times a year. We have a fantastic sim center, so I just can't say enough about that. Lots of leadership opportunities are available to you. Of course, we have a chief resident. We also do recruitment. We have a residency council through Spectrum. We have both a wellness and diversity group at Spectrum, which you can join. Graduation, we're going to have our first graduating class coming up this year from this current residency. These are pictures from the residency when we were still part of GRMEP, which split about 4 to 5 years ago now. But it's always fun. We have a really nice party downtown usually and invite families. Just to mention, we do have a diversity council here at Spectrum. This is part of the whole Office of Medical Education, but the goal is really to increase the diversity both in our residency and fellowship programs as well as in our hiring of attending and faculty moving forward. And they provide many outings such as this annual Whitecaps diversity event. They have book clubs, they have journal clubs, they have regular meetings. So and we do a residency recruitment diversity fair. So just really trying to increase the diversity. We also have a wellness committee here at Spectrum. They, again, also sponsor social events, but the nice thing is they sponsor social events for your family members who maybe are moving here with you to join you in your residency training, and people with young kids, they have family-friendly events. They also do some practical medicine topics like interviewing, personal finance, and we do wellness self-assessments for all the residents. These are just some fun pictures for different activities the residents have done during their orientation month. Here's some more. We are all at a park doing some volleyball. I annually host a barbecue during that orientation month at my house, with the exception of this year due to COVID. So I'm to miss out that. We have 2 retreats every year. We have a fall and spring retreat. These are really for you guys to kind of kick back, have fun, get to know each other on a personal level. We also are pretty competitive, so we do a lot of games. Here's our teams for one of the first years. Yes, I'm dressed as a pirate. It was on Halloween. The winners always get this traveling banana trophy. You can see Dr. Holman there in the lavender shirt. I'm just pointing that out because Dr. Holman is on the winning team once again, and there was some questionable cheating during some of the games. So if you come to our residency, you have to keep Dr. Holman. So people always say Disney is the happiest place on earth. Having been there with my children, I can tell you that probably is not true. But I would argue we're a pretty happy place here at residency. This is just a spontaneous picture I took one day. I walked into Nicole's office and my faculty was all sitting on the couch together, obviously pre-COVID, in a pretty happy embrace. I was like, oh, this is nice. This is at my backyard. So please join us. We'd love to have you come visit or spend your residency with us. And thanks for watching.